We are right now, we are streaming on Facebook, and we are also recording tonight's event. We're expecting a few more folks, but we will go ahead and get started. As you all know, I'm Lisa Reynolds, pediatrician and state representative for Oregon House District 36, which covers much of Portland's west side. And it's really nice to have you here tonight. My plan is to talk a bit about COVID because, I don't know what's going to happen when COVID's really over. The town halls could be half hour. And also to give you all, my perspective on the short session. I had a pretty lengthy newsletter out yesterday, and this may be covers a little bit of that ground too. And then, given, I kind of try to keep these pretty casual. So just time for questions and answers. So hi, Phyllis. Nice to see you. Hey, John. How's your ankle, John?
I've got 3 more weeks on the crutches.
Yeah, I see them in the background again, like Tiny Tim.
No, I like to say I'm a disabled veteran.
Yeah. Well, thank you for your service. Okay, here's someone.
Your service.
Oh, thank you. Thank you.
Sorry, Representative, I accidentally muted you again.
That's okay. That's okay. Wouldn't be the first time. Anyway, thank you all for being here. I'm going to ask Maida so just for those of you who just joined, we are on Facebook Live and we are recording this event. I'm going to ask Maida to give our land acknowledgement tonight.
Hi, everyone. Thank you again for joining us this evening. It was definitely a fun-filled session for us as well. But as usual, we just want to get started with a land acknowledgement and acknowledge that the land we occupy as residents is unceded Indigenous land. The Tri-County area rests on the traditional village sites of the Multnomah, Wasco, Cowlitz, Clackamas, bands of Chinook, Tualatin, Kalapuya, Molalla, and many other tribes who have made their homes along the Columbia River, creating both permanent communities and seasonal encampments. There are many other tribes and nations who lived in the region that are not collectively remembered, so we want to take this moment to remember their contributions in shaping our state and our country. And with that, I will pass it back to Rep. Reynolds for a COVID update.
So I just want to talk for a few minutes about COVID. Obviously, we were reminiscing a little bit earlier, Katie and I, and whoever else wanted to hear it, about it's literally like the 2-year anniversary when everything started kind of shutting down. And it was Thursday, March 12th, when the governor made her announcement that schools are going to close starting tomorrow, which is Friday the 13th, which is why I always remember it. And it was a week, it was going to be at least closed the week before spring break and certainly the week of spring break, right? It's so quaint to think back to those days. And, I was on the campaign trail at that time and knowing something terrible was coming our way. I mean, obviously it's all been much worse than I ever imagined. And also some interesting things have come from that too, but we are now at the point, at least for now, where, we've all seen the curves of the Omicron spike, which is, I was looking at just kind of the overall curve. It's like Omicron. So all that stuff about flattening the curve 2 years ago, which was really smart to do, right? Because we didn't have vaccines, we didn't have treatments. A lot of those people ended up getting COVID at some point anyway, but we're much better at dealing with it. But we're at the point with the rapid fall in case numbers, the decline in hospitalizations. We're below that magical 400 hospitalization point, and the slowing down of deaths, I think, gives the governor plenty of reason to lift the statewide mask mandate. So that will, Friday night at midnight, there's no longer an indoor statewide mask mandate. As you all know, there will be situations when you may have to, or we'd strongly recommend that you wear masks. I think the medical centers, most people are going to be wearing masks in those places for a long time, if not forever. I think we all realized how many kind of exam room and hospital acquired infections were alleviated or prevented by having masks. I'm not sure I'll ever be in an exam room without a mask now. although I may change my mind. And obviously people who are immunocompromised, people who have symptoms, people who know they have COVID, all those folks should be wearing a mask. US deaths are really close to approaching 1 million people. And if you would have told me that 2 years ago, I don't know what I would have said or done. I mean, what can you say or do about that? So it's really terrifying. Internationally, the whole world, deaths are at 6 million people. So I don't know the math on that, but I do know that the US has among the highest per capita death rate in the world. So to say that we have 1/6 of the deaths, almost 1/6 of the deaths of the world is pretty chilling. I think in terms of now local decisions being made on masking, I think the biggest news that has come out in the last week is that Portland Public Schools is going to mask optional. Clackamas School District is going to mask optional. Beaverton School District is going to mask optional. And when I talked to family, I was back in the clinic yesterday for the first time in 5 weeks, and like, oh yeah, no, we're not going to be wearing masks. So I don't think there'll be a whole lot of people wearing masks. One of my friends who's a teacher in Clackamas said she's going to continue wearing masks, if only to support those kids who still need to or choose to. And I thought that was really nice. I think the big thing that's coming out right now is this idea of long COVID, and we're learning more and more of that. So I haven't really dug into that, but it's this is a really, I don't know, tricky, horrific virus. A little bit interesting if you like this. I mean, the whole thing's been a little bit interesting, even though it's been totally heartbreaking. But more is happening on that. And then, of course, I think, don't throw away those masks. Don't burn them in a big bonfire. I know you won't. There are people who burned them in bonfires a year ago, and I know none of you did that. Because there may come a time, especially if a dangerous variant emerges, when we're going to start seeing that uptick in cases, and we may not know. There's a big lag between the uptick in cases and when we know how well the vaccine works against that variant. So keep your masks handy. And then, furthermore, I've been, again, day one in the exam room yesterday, I talked to several families of 5 to 12-year-olds whose parents were thinking, about getting the vaccine or not getting the vaccine. And, I shared with them, of course, I strongly recommend the vaccine against COVID. Hey, Kara, strongly recommend the vaccine against COVID. And that the parents, kind of assessment that case counts are much lower, community spread is much lower, is correct. And they're right that maybe their child's at a little bit less risk of getting COVID at this point. Also, the vaccine to 5 to 12-year-olds has not been as effective as we would like, but still offers some protection. And then I've been telling people be a good citizen, because the more people are vaccinated, the less likely we're going to have an emergence of a dangerous variant. But I was about 50-50 yesterday. I mean, there are only 3 or 4 patients who hadn't been vaccinated who were in my office yesterday who were eligible for vaccine. So in any case, that's really all I had to say about COVID today. Do we want to open up to COVID questions before I move on to short session? Are you guys sick of COVID? I mean, I'm super sick of COVID, but I do still find it kind of fascinating. But okay. So we're all good on that. So get ready to kind of swing those masks and, toss them. Be careful and be mindful. I know everyone here will be. I definitely talk through a lot of different situations with patients all the time. And I think I've talked to several of you, especially early on, about, does it make sense to do this travel? Would it make sense to do this with my grandchild? Always happy to talk that through with my own personal take on things. And I think you all know I'm fairly conservative and careful when it comes to COVID. So short session started 5 weeks ago yesterday, and in Oregon. And again, I know we have a sophisticated crowd here, but I'll just explain. In Oregon, the legislature meets in odd numbered years. So in 2021, last year, for approximately 6 months. It's called the long session. And that's probably when the bulk of budgeting happens. That's when our 2-year budget gets finalized at the end of that session. And in 6 months, you can pass a lot of laws. And it used to be that we only had every 2-year sessions in Oregon. But in 2015, I think it was, there's a ballot measure to pass short sessions in the even numbered years lasting 35 days, so 5 weeks. And I will say that a lot of times Republicans will say in the short sessions only for emergency measures or only for, they say it's only for emergency measures or little agency adjustments. There's nowhere that that's written. I mean, maybe that's custom, maybe that's how it was packaged and sold, but that's not anything in the Constitution. We can do whatever we want in the short session. And whatever we want, we actually did this year. Not whatever we want, but I mean, we accomplished a lot in this short session. Part of, in large part because we had record buckets of money to spend because of improved revenue returns in the form of tax receipts, because of a pretty robust economic recovery from COVID. And also because of ongoing federal funds as part of the American Rescue Plan Act, the ARPA dollars. So we allocated $2.something billion, which is a pretty astounding amount for a short session. I will tell you at one point, someone's like, it's sometimes hard to have too much money. And I'm like, no, do not say that. So spoken like a true politician, but no, it's not bad to have too much money. We can invest in things that have been neglected, and that we did. So I think some of the things that have been $2.7 billion, some of the things that have been particularly rewarding to be part of. I mean, first and foremost, and I still get kind of choked up thinking about it, we did pass farm worker overtime. Because in the federal constitution, as of 1938, farm workers were listed as exempt workers when it came to overtime payment. So working for more than 40 hours a week. This is clearly kind of entrenched in racism, if not slavery. It was very exciting to see that pass. There were a lot of rocky days. There were a few days, like if the Republicans were half hour late, we're like, okay, they walked, but they didn't. They stayed at the table. We made a lot. That was a bill that, like, from the first day of session to the day it was passed, which was close to the last day of session, underwent quite a few changes. We didn't garner any more Republican votes. And I don't know if those changes kept the Republicans in the building, but it was, even though this has been something, it's so interesting. It's been worked on for years. There were still things that happened in these not even just the last 5 weeks, even the last 2 weeks, including a whole special committee that was set up to kind of prolong some of the deadlines that were looming upon us. I will tell you, and I wrote this in my newsletter, I watched quite a few of the hearings on this topic where the public came in, and you heard from farmers and you heard from farm workers, and it was tough. It's really hard to hear the stories of farm workers. And I think we all have to empathize a little bit that this is going to change the economic game for farm workers, but I'm sorry, for farmers, farm owners, but it's time. And not to put too fine a point on it, but I remember years ago being with my kids in Savannah, Georgia. And, the waterfront there is where all the cotton was shipped over to England, and how that was such a huge economic boon for this fledgling land of America. And the tour guides would kind of explain how it was important to use slave labor because it just helped, raise the revenue for the entire country. And I'm like, oof. Some of the discussions around farm work overtime from the farm owners echoed that a little bit. I do think, and I've said this several times, we probably all have to prepare ourselves to pay more than, whatever it is, $2.25 for a head of lettuce, right? We can pay $2.25 because the person who's picking it makes hardly any money and lives in deep poverty without any healthcare or benefits. So the times they are changing, there was also a lot of other ways in which we supported workers who are traditionally fairly low wage. And by that, I mean behavioral health care workers and providers of childcare. There are some one-time, and actually for childcare workers, two-time payments going out, specifically to behavioral health workers to retain workers and to recruit more workers. Same with the childcare sector. And then you may have heard of Representative Valderrama's bill, which is a one-time payment to low-income Oregonians. To the 250,000 Oregonians will be receiving a one-time payment of $600. And, you know, the thinking is those folks are the ones who are most likely are essential workers who showed up in the grocery stores. And this is just helping them navigate this, the post-COVID world. Maida's like it's like my narrator putting in the bill numbers and stuff. In the end, we passed 119 bills and allocated $2.7 billion. Oh, another great bill that passed is the that we talked about last time. I couldn't remember the name, and Rob Fulmer helped me, but we will say it now, which is the I can't find it. Geez Louise. The energy infrastructure. What is the C for? No. Anyway, the energy infrastructure hub, CEI hub, but the C, what does the C stand for? This is so terrible. Rob, where are you? Rob Fulmer helped me last time. Critical energy infrastructure hub. Thank you. So you guys, and again, I've talked about this before, so I'm sorry if I'm repeating myself. We have a thing in my family. If you're repeating yourself, we just go, heard that one. But the critical energy infrastructure, you know, when you guys drive along the Willamette River, along St. Helens Highway, especially in and around the beautiful St. John's Bridge, all those huge, you know, cylindrical storage, it's liquid fuel, and it's on, and it's in the liquefaction zone for the next earthquake. So you can imagine that, when there is a subduction zone earthquake, it's going to cause quite a bit of damage to that part of the city, and could create, you know, health and biohazard, you know, way beyond the horrible damage that will happen by the earthquake. So there's going to be studies going into how to shore that up, and kind of like not a moment too soon. People have been talking about this, you know, for a decade, and it feels like we're starting to finally actually do something. There is state-of-the-art things where we know those containers can be made much more safe from cracking or spilling in the event of an earthquake. You all know, and I certainly see Kara and Jerry here from my Moms Demand Action days, that I got my political start with Moms Demand Action for Gun Sense, and I have been all in on gun violence prevention legislation. Last year was particularly rewarding because we passed safe storage and allowed schools to ban guns from their campuses. This year we took a little bit of a different tack. We didn't do one of those straight policy bills, which we will do next year, like Charleston loophole and ghost guns. We looked at funding sources for kind of upstream programs to prevent violence. So one was a bill, actually was originally brought forward by Tina Kotek, who is no longer in the legislature as she's running for governor. There's a hospital-based intervention program that when a victim of a violent act, whether it's a stabbing or an assault, you know, a physical assault, or a gunshot, when they show up in the ER and they're in that high risk zone, and John might be able to talk to this, they will summon a specially trained community member with lived experience who will come and almost become like a big brother or big sister to that victim and help them recover physically and emotionally from that violence, and really try to interrupt the typical cycle of violence that can happen after that, whether it's retaliation or returning back to the community in which violence is still a major disruptor. So things like job training and housing, and like I said, physical and emotional support. It's been shown, you know, for those people who are victims of violence once, have a very high rate of being a victim of violence again, and often 20% leading to death. This has been shown to cut all that like easily in half, if not more. So these are programs that are happening in Oregon. They're working. So this bill funded those programs more fully, help fund new programs. And more importantly, and I love this model of like, we're going to put resources, we're going to give it to you now, but we're also going to put in place a mechanism for stable long-term funding. And so for these hospital-based programs, it'll be for to get Medicaid reimbursement for those services, and to have this community member who is trained now, but almost like licensed going forward. So that's really exciting. The other thing is we just did a straight out ask for funding of a grant program for community-based organizations, whether they come together for this money or they're established, whether they're already doing this work or they want to try some new things, but to provide evidence-based community violence intervention programs. And I'll give you some examples. And again, these are programs that have been shown to lower gun violence. There was an article last week in the paper. And again, if anyone reads my newsletter carefully, some of this will be repetitive. Joanne Hardesty heard that in Southeast Portland, people would be shooting guns and then speed off in their cars. And there's a certain park, I can't remember the name of the park, where this was happening fairly routinely. And so they started putting traffic cones in the middle of the street, and gun violence in that community fell by like 60%. I mean, it's just brilliant. This is all really short term. It was, 3 months before the cones, 3 months after the cones. And one of the staffers I was talking to one of the staffers in the speaker's office. She's like, oh yeah, I live right near there. And like over the weekend, she sent me pictures of the traffic cones, not the little traffic cones, like the big, garbage can sized cone. So it's just so interesting how we can do that. And most of the research would suggest those people don't go somewhere else to shoot guns. It's like if the opportunity is taken away, it's taken away. There was something unique about that geography and those big wide boulevards that made it easy to shoot and get away. Other things kind of in that same vein in Philadelphia, when they took blighted neighborhoods and built gardens in the empty lots and pried off the plywood from the houses and rehabbed them and rented them, gun violence goes down by, I think it was 38%. And again, it wasn't displaced to other neighborhoods, it just goes away. Here in Portland, there's a mentorship program for young Black men called Word is Bond. And I think the mentorship and job training just gives those young men quite a bit of hope and motivation and kind of, belief in themselves to move forward. There were really great walking tours in February. I know Jerry went on one. I was able to enjoy a few of them. I think a couple other of you guys might've been here. Really amazing stuff. And I can't wait till they do that again next year. You all need to join these young men and it's off the beaten path stuff. It's not like now we're going to Pioneer Courthouse Square. And then a program in Oakland, which I know folks are looking at here in Portland. When they looked at gun violence in Oakland, they found that there were like 15 people who are the most often perpetrators of gun violence. And they're kind of cycling in and out of jails and ERs and things like that. They just hired those 15 people. They trained them to be kind of, I don't want to say peace officers, because I think that's what they call police, like kind of peacemakers and de-escalation. And they hired him with a good living, and gun violence plummeted. And I know that Joe McFerrin, who is the executive director of the Portland Opportunities Industrial Center, which runs the hospital-based program. This is his dream, is to start doing this, to kind of, let's get those influencers and let's change what how they're influencing. And I think it's just really interesting. Again, these things have all been shown to work. And I've been reaching out to the programs about this nice success we've had with this funding package, $15 million. We asked for 50. We got 15, and I've been told, like, come back to us, show us what's happening, and we will definitely, refill those coffers once they're empty. But we do need to show that how that goes. Yeah, it's less than half of what we asked for. There are a lot of other things we did, like $400 million for housing support and things like that. So, you aim high on those dollar values. I mean, I'm glad I didn't ask for 15. We would have gotten 5, right? I mean, it's so weird. I'm not necessarily liking this negotiation stuff. Not that I was negotiated. I just asked, and that's what they gave me. Some great work for our environment in terms of preserving some forests and also changing how we log areas around sources of water, both for drinking water and both for fish. And this is like a huge improvement in our logging practices. The first big improvement in 50 years. So I think we're probably close to matching California and Washington's measures on this front. So yes, there's always next session, Jerry. We'll get there. That was a couple things I do want to bring, because I know we have a lot of healthcare people here, but one is you know, a lot of the job training stuff, right? The governor had Future Ready Oregon, which was a $200 million investment in workplace training. We know that there are a lot of sectors in Oregon that can't find people to do the work. So we're going to train people to do the work. And then last year, we passed just kind of a ceremonial thing to adopt the concept that racism is a public health issue. This year, we're putting some action into that by funding mobile health clinics that are culturally competent. And, you know, really the person behind that work has been my colleague, Representative Andrea Salinas. And she's leaving the legislature because she's running for Congress. So I think Travis Nelson and I will be taking on that work of what else, you know, all the different ways that we can confront and mitigate the health effects of racism. And then I know a lot of us here were very upset by the heat dome deaths of last summer. So there was a combination, there were two bills that were kind of morphed into one where there will be actual resources for people to buy heat pumps, which are a little better on the environment for air conditioning our homes. And we are really not allowing, we're making it much harder for landlords to resist having air conditioning units put in their apartments. And then also making it easier for people to host cooling shelters. You know, it is this admission that this is going to happen again, right? We've done everything we can to mitigate climate change, but climate change is here. And now what are we going to do to protect Oregonians against it? There's definitely some wildfire work done and all of that. So that's kind of all. I feel like I've talked longer than I would really like to. I just really would love to make this a discussion, question and answer, or however you all want to do that. It's nice to have you all here tonight. And it's still kind of light out. I'm looking out my window. Whew, days are getting longer. Love it. John.
Okay, so one question and one comment. The question is, there was talk about increasing legislative pay, which I support, and it didn't go anywhere. Did it die because of Republicans? A lack of Republican support, or why did it die?
We were told, okay, first, this is kind of the stuff, here's the stuff that's kind of hard to hear as a legislator. We were told that it didn't kind of get in the hopper early enough, didn't really get through the whole process. You know, it's like, then tell us how to do it, right? Because it was brought forward by some of the younger legislators. I support it, but I wasn't one of the lead people on it. And then we were told that we didn't have enough votes, period. So that means Democratic votes. And I will tell you the reason why I think we didn't have enough Democratic votes. Again, I support it, is this comes off sounding like, oh, you could just hear it, right? Oh, they raised their own pay. You know, here we are struggling at home. So, and we all, I think everyone here understands the reason for raising lawmaker pay. So legislators make about $31,000 a year. Although to be fair, because we get a per diem in long session years, it's closer to 50. But of course, we are paying we pay for food when we're down there. A lot of us stay overnight. You know, there's a reason you get a per diem, but some people can kind of squeeze that out a little bit. A lot of, I will say a lot of legislators, more often on the Republican side, will hire family members, especially spouses, as their chief of staff. And so then they get that state salary for their staff member, which is higher than what the legislator makes, and that people can make that work. The reason why we want to raise pay, and it was proposed to raise it to $57,000, which is the median, I think it was the median kind of family income for a family of four in Oregon. The reason that was also nice is it would just float up and down as the median income would float up and down. So we wouldn't have it be a number in stone that we would have to continually raise or lower over the years. But we know that for a job that pays $30,000 a year, only certain people can do that while they're providing for a family. So I can do it because I've been a doctor for 25 years and I have savings, and I can work part-time and make a pretty nice living as a part-time pediatrician. I will tell you, and this is probably more because of the time the job takes. I don't think I could have done this when my kids were little. It's no coincidence that I ran for office after my kids left home. I kind of joke like, you were gone, I was bored, so I decided to run for office. That's not true. Obviously, it's much more involved than that, but it is no coincidence that it happened after my kids left home. Although I did kind of look around like, so what now? And then lastly, I mean, and then the counterpoint to that is, it definitely turns people away from running for office. And then it turns out that people who do run for office are people like me, upper income white people. There are a lot of PERS retirees in the legislature. I'll be honest, retired teachers, retired police. They're awesome. They contribute a lot to the issues and to our understanding. But they're not making $30,000 a year. They're making $30,000 plus a nice, PERS retirement. So we really want our legislature to better represent Oregonians. We want young people. We want people of color. There was the dramatic and really well done exit and very heartbreaking exit of Representative Anna Williams, Representative Rachel Pruzak, Representative Karin Power, saying this is just too hard to do and still take care of our families, or still trying to juggle a second job. And so they all said that had the bill passed for increasing lawmaker pay, they would have stayed. So it wasn't like if we're going to leave, it was like, we can't make this work. Hey, we could probably make it work with a higher pay. It wasn't a a threat. It was just the reality of where they were in their lives. So I hope it comes back. I hope we can message it in a way that people understand. I will tell you, not that I should take too seriously Twitter, because people are so awful to me on Twitter. But when I kind of said, I'm really going to miss Anna Williams, Rachel Pruzak, Karin Power, and, we need to really think about, kind of living wages for legislators. I got some of the most hateful responses, and I've gotten some very hateful responses when it comes to vaccines and masking. This is public service. This is, so in any case.
Okay. So I have comment on something else.
Yeah.
Our question for you that, as I believe you are aware, independent pharmacies have been closing across the country, and it's especially a problem in rural places like rural Oregon, where if the pharmacy in the town closes, then people have to drive, an hour or two to find a pharmacy. There is a Band-Aid put on with a tax measure, which makes everybody feel good and will do absolutely nothing to solve the problem. It's a problem that should have been addressed by the healthcare committee. The healthcare committee now has all departed, at least on the Democratic side, except one person. So one is, do you want to get on the healthcare committee? And two, will you do something about, because it'll take a year to develop it, a solution to the pharmacy benefit manager law that basically screws over independent pharmacies and is doing enormous damage to our healthcare system.
Yeah, no, thank you for that, John. And you're right. Yes, I do really hope to be on the healthcare committee. You're right. And it's a big committee. I think there's 12 or 13 people on it, and they're all leaving save one, which is Maxine Dexter. So yes, I very much hope to be on it. If I'm not on it in 2023, there's something really wrong. But in any case, yes, I mean, the whole pharmacy benefit management system is such a disgusting, grotesque, political patronage, lots of money flowing back and forth. And there are a lot of people who've tried to crack that nut. And maybe you're not saying we need to reform the entire thing, although we should. And I will just say one thing. I do not like Donald Trump. He was evil incarnate. His administration was starting to look at some interesting things to do there. And I don't think that's been continued by Biden. I don't think for any reason other than, Biden's been busy doing other things.
That part is not true. There is a movement by to do some things at the federal level through the administration or through one of the agencies. It'll be a partial fix, but it'll actually do something. But there are states who have taken state action. And
well, I would love to talk to you about that offline for sure. Maida can set up an appointment, but you're right. And I know, and Rob knows a lot about this too. So I think it's way overdue for sure. But thank you for that. Patty, are you, there you are, your little hand over your raise Raise Up Home Care. Hi, Patty. Thanks for being here.
Thanks for having us. This is terrific. Good to see you again.
Nice to see you too.
I want to revisit the heat relief package, the 1536. I read the language on it, and while it does talk about the restrictions to landlords and homeowner associations and everything, I don't see the language about low-income families getting some help with funding for air filtration and heat pumps and that. And if it's there somewhere and I just missed it, what is the process going to be? Because I'm concerned that we have folks, you know, we lost over 100 people we should not have lost the last heat
Right.
dome. And I'm concerned that folks are going to get down to June and not be able to get a contractor or not understand the process. Perhaps case managers aren't going to be letting people know that this is available. I just want this to be a smooth, easy process for folks to take advantage of.
Great question. And just such another reminder that we can, you know, write our newsletters and, you know, yay, you know, cheers to, you know, vote, you know, changing this, you know, making this law. The devil's in the details. And I don't know those answers, but we will get to you on that. And I think some of the things that happen in this session, and I'm a little worried that Emily and Bill didn't get the memo that we started at 6. Sorry, Emily, I'm going to a concert tonight. Some of the things, like I have that, I talked before about the gender response coordinator bill to look at special needs for women who are incarcerated. And so we had a bill, we had all of our, you know, public hearings and people testified, and it ended up that we didn't actually pass the bill, but it got funded through a different, you know, through the budget mechanism. The position and the project got funded because they're like, this isn't really a policy, you know, a dramatic policy. This is just a project that needs to get funded. So I think that's probably what happened with the heat pump stuff, but we will get back to you on that. Great. And then, Bill, I just want to tell you, we started tonight at 6. I changed the time, which I'm always hesitant to do. My staff knows I hardly ever do that, but I got invited to a concert that I have to leave here a little after 7. So I'm sorry if you missed the first half, but you can always watch it on Facebook later. Great. And thank you for that question, Patty. And I will tell you, and I've talked about this before, you know, the passing of the bill, I wouldn't say it's the easy part because it can be very challenging. I certainly saw that with Farmworker Overtime, but then it's, you know, really making sure that things get in place to do what we intended when we passed that bill. Last year I was, and Katie was at a meeting today, but last year I was involved with a bill that has to do with, you know, safety plans for adolescents who are at risk for, who are feeling suicidal or at risk for suicide. And I had some concern about the bill because number one, it seemed to emphasize that we as providers should inform the parents. We certainly tweaked that language before we passed it. And I kept saying, but wait a minute, this is what we're all supposed to be doing. You know, when we know an adolescent is feeling suicidal, we have to make sure that adolescent has a safety plan. Well, it turns out, you know, not all providers were doing that. And I don't think it's out of neglect. I think people aren't really sure how to manage this process. So this bill has now turned into and correct me if I'm wrong, Katie, what seems to be a really cool education program for all people who take care of young folks who are at risk, which is every young folk, especially now. And even interesting language of how you talk to young people and setting up safety plans with young people before they're really in crisis. Like, who are your trusted adults? You know, you always hope it's the parents, but obviously we know in a lot of situations it's not. I don't know, Katie, if you want to add any more than that. Katie's there on behalf of, she's a government relations person for both pediatricians and psychiatrists.
And also for emergency physicians.
Oh,
too.
that's right. Right. And then speaking of which, we're going to go to John next, but yes.
Oh, good. Yes, because they help a lot of people in mental health crisis as well. I think it's exactly what you said. I remember when the bill was up for a hearing and you said, but this is what I already do. And the problem was there were a lot of other providers that misunderstood what they were able to do or not do under HIPAA. And so while this bill doesn't change a lot, one of the things that it does do is we have a large dedicated group of folks working to clarify what behavioral health providers can and can't do for people in crisis, and to amplify the message throughout their networks. And there's a child and adolescent psychiatrist, Dr. Daniel Nicolai from the Oregon Psychiatric Physicians Association, who's leading the provider work group, and Julie Schultz, the executive director for the Oregon Pediatric Society, is also engaged in it. It's a neat effort. And
Yeah, I feel like
attending that meeting.
Yeah, no,
attending today. We normally meet when you have clinic.
right. It worked out today, and it feels like it's going even beyond the intention of the bill, which is a good thing, you know, beyond the kind of somewhat narrow intention of the bill. So
credit to the Oregon Health Authority for convening the broader work group, because the bill wasn't funded and they didn't have any distinct responsibilities, but they stepped up to act as a convener. And they'll also help with some of the graphics and using their website as a landing page for this, so providers and parents and other folks can go to OHA and get resources.
Yeah, so it's very, very cool, and just so many amazing people coming together to do this work. And that continues to humble me, just in terms of how many great, amazing people there are in public service, both in terms of, you know, agencies within the government, you know, within the executive branch, but also advocates and, you know, physicians lending their time. And, you know, the person who spearheaded this is a woman whose daughter, you know, killed herself a few years ago. And this is her life now, is trying to prevent this from happening to any other family. And it's very powerful. Dr. Moorhead, thank you for being here.
Dr. Reynolds, how are you? You have lots of energy. It's good. Do you have all that energy to get all these things done? Thank you for everything you're doing. I did want to comment on the victims of violence. I think it's, as you said, so important that funding wasn't just put up front, but you provided some long-term, and I think people are really going to benefit in this state from that effort. And really, thank you for your part in that. And funding workforce, particularly in behavioral health, I mean, it's unbelievably necessary. Thank goodness we had the dollars to be able to fund that. That's really going to be helpful. But of course, we want to keep them in the workforce, right? We want to keep them working. And I want to thank you for your vote on 4142. I know it was a difficult vote for you. I just want to emphasize how important these measures are to keeping our workforce active, particularly on the front lines. And we'll keep working on it, and we'd like to work with you to find long-term viable solutions. But thank you for your vote, and it's been well recognized, so thank you.
Yes, thank you. And we won't get too much into that bill. It didn't pass, but we are looking at ways to protect, you know, there's an increasing number of assaults against healthcare providers, you know, and this is always problematic in large part because I think, especially in an emergency room, it is probably that person's worst day of their life. You know, they're sick, they're ill, there might be psychiatric issues involved. And so we're looking at ways to protect healthcare workers. And so anyway, and I did text with Katie when I saw her in the other meeting about, you know, work groups going forward to help solve that problem. And thanks for your advocacy on that as well. And I will say, I did receive an email from someone who said, so tell me how behavioral health, why are we still at the bottom of behavioral health you know, in terms of access to behavioral health services, access to, for kids and adults, for substance use disorders. No one is, I shouldn't say that. It's very upsetting to me as well. And we have started, you know, as of last July, we have devoted record numbers of dollars to this effort. We aren't really seeing the improvements yet. And believe me, I ask for them when we meet with the folks who are starting to implement the programs of the bills that we passed last year. It's all happening way too slowly, but we're watching it. We're really trying to hold agencies accountable to actually start making a difference and move the needle. I will tell you all, I think a lot of you heard about the amazing gift from the Ballmers, you know, Steve and Connie Ballmer, former CEO of Microsoft, donated or, you know, bequeathed $425 million to the University of Oregon to start a child behavioral health institute on the campus of Concordia University. The plan is to get to the point where they're training 200 people a year, specialists in kind of pediatric behavioral health services. Like, I get a little choked up thinking about it when all my partners are like, I'm getting goosebumps. I mean, it is unbelievable. And we're so lucky it's here in Oregon. I kind of joke a little bit. We're so lucky that Steve Ballmer's wife went to U of O. We are, just like we're lucky that Phil Knight went to U of O. So it's really, really, really amazing. And this is going to be a game changer. And I know it's going to still take some time. There's going to be a lot of working with schools. I mean, this is all private money, right? And this is a really, really beautiful thing. And, you know, it's just unbelievable. Really talk about putting your money where your mouth is and doing such important work. The other question was like, what can we do on, like, the other, you know, couple things we didn't get done this session is campaign finance reform. Maybe we could talk about raising lawmaker pay, but also are completely shattered. And now we are out of constitutional directive in our public defender system here in Oregon. And I don't know enough about the history of why we got to such a bad spot, but we're like short 1,000 public defenders in the state of Oregon. So I think we funded 30 this session. And that is the thing that kept coming up the last few days of sessions. We did not fix this problem. Some of my mentors just voted no on the entire budget because we didn't fix this problem. The budget still passed, of course. So work is being done on that. That is one of those things that I think has the votes and the support, but it's a sticky wicket to fix. So I hope that happens by the time we convene again in January, or there's actually already been discussion about maybe we'll need to, if we figure out a fix or we figure out some solutions, we may have to come back in for a special session. It's that important between now and January. Campaign finance reform, again, I don't know enough about the history there, but it continues to just vex me that we're never able to get anything across the finish line on that. Certainly in the 2 years I've been there, but in the many years leading up to that, it has been something that Dan Rayfield has been, continually interested in doing, and he has tweaked a lot of different bills and tried a lot of different things. He is now Speaker of the Oregon House, which is one of the most powerful positions in the country. So if not now, when? I don't know. You may have seen some of the drama around. There was going to be some ballot measures in the November ballot. Those have been disqualified by the Secretary of State. The people who designed the ballot measure did not do it properly. And so she disqualified those. So the chances of them being able to get requalified and get enough signatures by July something, it's usually like 80,000 signatures, I think is not likely. Some other ballot measures that we're expecting in the fall, there's some magazine size limitations for semi-automatic guns. So that there's some gun measures coming up, which should be really interesting. So I think work is being done. It's hard. Politics is challenging, and there's not always a clear or logical path on how to get something passed. Canada took corporate funding out of all elections, only individuals. It's working well. Yeah. It'd be really nice if we didn't have corporate funding of elections. That really makes sense. I think the whole, the Supreme Court decision that said corporations were people and they have the right to free speech, that was right. That was the beginning of the end of some of this. I don't know if any of you, I don't want to get too far off topic. I don't know if any of you are watching the race at the U.S. congressional seat 6, which is the new district that Andrea Salinas, who I mentioned earlier, is running for. There's, I think, 7 or 8 Democrats running, but 2 of them are like Bitcoin millionaires being further backed by other Bitcoin bazillionaires because they want to affect Bitcoin policy. I have to admit, I still don't understand Bitcoin, and I do understand a little bit about how supply and demand influences price and things like that. And that the Bitcoin, if it's something you invested in 5 years ago, you could be a millionaire now. I just kind of don't like that concept. I feel like we should, you should have a really interesting business idea before you make $1 million, not just get super lucky with a weird, whatever it is. I know that Bitcoin uses quite a bit of energy. It's not a great environmental thing, but that's about all I know. Please don't ask me any Bitcoin questions. But what ends up happening is so much money is flowing into this race for this congressional seat. And now people like Andrea Salinas, who's kind of like me, she's a state legislator with keen interest and expertise in healthcare policy, is having to really, figure out how to counteract that money. She's not gonna be able to match it, but how do you counteract that with messaging or, of course, direct voter contact is always the most important thing. So it's definitely challenging. Yeah, it is like magic money. Well, great. We're getting close to the end of our time together. If anyone else has any questions, we have a few events coming up. So next week on St. Patrick's Day, which is Thursday at 5:30 p.m., I'll be participating in a combined town hall with my Senator Kasha Lawrence Spence, and then my kind of sister legislator, Representative Dacia Graber. It'll be kind of similar to this in terms of end of session, but also looking ahead. I haven't even talked about looking ahead. We're still organizing that in our mind. We have, what did we have? Made a 25 concepts we're thinking about for long session. We're figuring out how to organize that and seeing what my colleagues are doing. I will be doing a kind of casual constituent coffee on Zoom Saturday, April 9th from 9 to 10. And then we are having a town hall, I believe it's April 20th, that we're going to try to do it in real life, and maybe and we're committed to doing a hybrid process so that those of you who would rather join from your living room, which is certainly much more convenient, better for the environment, can do so too. So we have things coming up and you guys can always reach out to me for anything. When I had those office hours when I was in session, those went really well, and I will certainly reinstitute those during the long session and make them more regular as best we can be. Yeah, I don't know where the real life session will be. Do you guys have any ideas? I keep thinking we have to be outdoors, but maybe we don't because COVID's done. We'll figure out a place that feels safe and comfortable for people. I think an indoor spot, maybe with really good ventilation, would be great. So yeah, place at the fireplace and lots of wind coming through. Thanks, Kat. Well, great. So wonderful to see you all. Thank you all for spending your evening